Hello ladies and gentlemen, welcome to Mr. Coco's Nesses class. So we would like to look at a condition called prematurity. Prematurity, just as it says, pre is up before. Maturity, to get to term or to reach at a certain age which is acceptable. So let's look at what it means when we look at prematurity in pediatrics. So when does this occur when we talk about prematurity? Okay, so this condition, is it something common? Yes, it is very common in your papers. So you'll find that you write an essay about prematurity, and then you'd find that apart from an essay, you'll be able to answer questions in one word or completion, then MCQ, or even cross match. You'll be able to find these questions. So under prematurity, they'll ask you a lot about the definition. You need to know the definition because that is what they'll be bringing in one word answer, or even you can say completion, or even multiple choice. So they will be able to ask you about this. Then what other things will they be able to ask you about? Will be for you to write the signs and symptoms, or let me say clinical features, okay, and the essay. So under that essay, you should be able to write even these clinical features, which is very, very important. And then what else would you be able to write when you're talking about prematurity? You'll be able to write the nursing care plan. So the nursing care plan, you should be able to at least know 5 problems that you'll be able to identify. Okay, what else should be able to know about this? You'll be able to know about the nursing care or the nursing management, or just the general management. You should be able to know about prematurity. So any other thing as a student that you need to be able to know about this, you should be able to at least know the kind of drugs that you'll be able to give, because they'll ask you about the drugs that you'll be able to give in a premature baby. Now, when you are handling this question, okay, in your maybe paper, will it be an emergency or just ordinary care? That will be the first thing before you attempt that essay. Is it an emergency or just ordinary nursing care that I'm going to write? So you need to at least know what you're answering before you even start attempting to write, because you get confused sometimes. You've written maybe 5 pages, then you realize it is an emergency or it wasn't an emergency. So it's quite tricky. So what you need to do is, well, is this premature baby having any other attached issue, such as maybe a failing to breathe, or we can say dyspnea, or anything in relation to problems such as breathing? Or is this a premature baby having issues to deal with hypoglycemia? So you need to know, you need to ask yourself in the stem of the question, you need to know, is there any hypoglycemia? Is there any problem breathing? Is there anything that can qualify this condition to go into an emergency before you start writing? If you're satisfied it is not an emergency, then go ahead and write the nursing management, which is just a prophenema, no need of resuscitation. But if you find those markers to say hypoglycemia, or you find something to do with anything like dyspnea, cyanosis, anything like that, meaning you need to resuscitate. Okay, that's what you need to do. Or is the child fitting? If you find maybe the child, they'll say a child is jerking, they'll use maybe a word jerking or fitting or convulsions, anything like that. Is there such a thing? Then you're satisfied. So let's move on. So that's what you need to really mark in your question or stem of the question. Okay, so let's move on into prematurity. So when you're looking at prematurity, the first thing that you need to know is that what are the issues that you're looking at? You're looking at the age of this infant. The age is very important. So let's start. So when you look at the definition of prematurity, you're looking at a condition in which a baby is born. Okay, baby is born after 28 weeks of gestation. So that's the first thing. After how many weeks? 28 weeks of gestation, but before 37 weeks of completed weeks of gestation. Okay, from the last day of the menstrual period, regardless of the weight of the baby. So let's go back to this again. So the first thing we're looking at is this condition in which a baby is born that's after 28 weeks. After how many weeks? 28 weeks. But before 37 weeks of completed gestation. So that's the period between 28 and 37 weeks. So after 28 weeks, before 37, after 28 weeks, but before 37 weeks of completed what? Gestation. But you need to count from the last menstrual period. Okay? Last menstrual period, but then regardless of this baby's weight. So that's the definition that you give out. So it's it's a condition in which a baby is born, okay? Baby is born after 28 weeks, but before 37 weeks of completed gestation, from the first day of the menstrual period, regardless of this baby's weight. That's what you give as a definition, okay? So other issues that we need to look at now will be the causes or predisposing factors. So if you look at the causes or predisposing factors, we are categorizing them, because under this condition, they'll ask you when you're writing your essay, they'll say maybe write about 5 maternal factors that would predispose to a premature baby, or they would say write the fetal causes of prematurity. So you need to just understand that, okay? Maternal causes of prematurity, just those strictly. When they say fetal causes of prematurity, you need just to write that, okay? So you need to know which category they've asked you to write. So let's start with number 1, maternal causes. So you need just to know the maternal causes, then you move on to another one. So maternal causes, number 1 is previous history of abortions. So you need to know if this lady has been having spontaneous abortions, just abortions previously, so they're most likely to give birth to a premature baby, okay? Then you need also to look at another one, would be maybe cervical incompetence. Cervical incompetence meaning that the cervix of a woman is not really strong enough to handle or to hold the fetus in utero. So it opens up, lets out the fetus. Okay, that's the cause. Another one would be maternal age. So under maternal age would be that those ladies who are below 20 years and those above 35 years of age are, at risk of giving birth to a premature baby. That's what happens. Another predisposing factor would be maternal illnesses. Under maternal illnesses would be infections. Infections such as maybe urinary tract infection. The mother is having a urinary tract infection, so it will affect the uterus, then the fetus will come out. Maybe say renal conditions. Renal diseases can also be a predisposing factor. When a mother is having a renal condition, meaning that it will affect also the supply of blood to the fetus, or even just those waste products such as maybe urea will affect the placenta. So there will be a lot of issues that will be affecting the placenta. Then heart conditions will affect this woman, and when this woman is affected with that heart condition, the placenta will be affected as well, because we know that the placenta supplies nutrients and oxygen to the fetus in utero. Okay, so that will be the in terms of the illnesses. Then hypertension also be the cause. We know hypertension, it will restrict the amount of blood that will be going to the placenta. Hence, this fetus will not receive enough oxygen, enough nutrients. That's what we have learned. Okay. Then another category, apart from what we said we looked at maternal causes. Okay. So under maternal causes, you've seen there are more than 5. Under maternal causes, there are more than 5. Abortions, cervical incompetence, maternal age. Then under maternal illness, we have got a lot. Hypertension, heart conditions, renal conditions, malaria. So those would be under illnesses. And that's under maternal cause and illnesses. Okay. Then let's look at now the other one, which is social class. Under social class, we're looking at those maybe who are living in conditions which are overcrowded, like there are a lot at home, or maybe in that environment there are a lot. So that can predispose. That's what science says, because there are too many people, so meaning that there will be a lot of infections as well. Then social class also involves also poor nutrition, meaning that this lady will not be receiving enough nutrients to give to the fetus. So then the fetus will be a premature. Okay, so that's what it says there. Okay, then let's look at another one, which is cervical pathology. Under cervical pathology, meaning we're looking at problems to do with the cervix. It can be maybe fibrosis, meaning the cervix is hard or hardened. So there can be just those things which can affect the cervix. So that's under cervical pathology. What about uterine abnormalities? Okay, under uterine abnormalities, what is there? Uterine abnormalities, we can have a biconjugate uterus or fibroids, which are affecting the mother. So if you look at the maternal causes, we have a lot. So we started with, if you look at that, we started with previous abortions, which is maybe say cervical incompetence, maternal age, maternal illnesses, which you've mentioned, social class of the mother, cervical pathology of the mother, uterine abnormalities, which I've said that in the uterus there may be fibroids. Then we can also have toxins, which is smoking or alcohol or drug abuse by the mother. Okay, that can be the cause as well. Then we can also have what we call trauma to where? To the uterus, meaning that this woman can either fall down or this woman can be beaten. That's what happens. So that's under trauma. So we've looked at now the maternal causes. Now let's move on to the placental factors. So maternal causes are a lot. Okay, then let's look at placental causes or factors. Under the placental factors, it's another category. So we're going to say there can be antepartum hemorrhage, meaning bleeding, okay, before someone delivers, or placental previa, meaning that the placenta is attached maybe closer to the cervix there. That's what happens. Then you can also have a placenta abruption, meaning that the placenta is having partial separation from the uterus. So that's what we can have under placenta factors. Then the other category would be fetal causes. So they can ask you to also write about the fetal causes only. So we've talked about the maternal causes. Now we can also be asked to talk about fetal causes or placental causes. Okay, now let's look at fetal causes. Fetal causes of prematurity can be multiple pregnancies. Under multiple pregnancies, meaning that there can be 2 or more fetuses in the uterus. So they can be fighting for space, and then space in the uterus, as we know, is limited. So this, as you deliver, you may find that instead of delivering after 37 weeks, you deliver before that, but after 28 weeks. So you can deliver between 28 weeks and 37 weeks. So these fetus or fetuses can be expelled. That's what we're calling multiple pregnancy. That's under fetal causes. Then we also have congenital abnormalities, such as maybe hydrocephalus and spina bifida. So if you have learned about hydrocephalus, you know that this is water in the cranial cavity, so which is excess water, which is CSF we're talking about here. So we're looking at this. This can also predispose to a premature or a lady giving birth before term. Okay. Then also conditions such as spina bifida. Okay. There can also be infections which can affect the fetus, such as syphilis, okay, or HIV. Syphilis or HIV can lead to prematurity because the child can have these infections can be expelled early. Okay. Then another condition can be premature rupture of membranes. So premature rupture of membranes, meaning that if membranes rupture, you know the membranes, okay, the chorion and the amnion. If they rupture, meaning the amniotic fluid will be drained out. Even the fetus will come out. So that's what happens there. Then another issue is intrauterine growth retardation, meaning that the fetus is not growing, okay, so it's not progressively growing, meaning that it's just stunted while in utero. So meaning that this can lead to a fetus, you know, coming out or being expelled from the uterus. Okay. Another category of the causes can be iatrogenic factors. Iatrogenic factors, you know, what happens is that when we talk about iatrogenic, we're looking at the health workers causing a problem. So even health workers can cause a problem, and then problem that can be caused by elective induction. Okay, meaning that you give drugs, okay, such as maybe say misoprostol, Misoprostol, you give it, then the fetus is expelled. And then it's expelled before term. So meaning that we are the cause for that premature delivery, okay, of the fetus. So that can be iatrogenic. Or another cause under iatrogenic, meaning us that we can cause, is by maybe incorrect assessment of gestation. Meaning we haven't assessed properly to say this fetus is maybe full term. We haven't assessed correctly, so it can be expelled. So that's what we have there. Okay, let's look at now the characteristics. What I mean by the characteristics is that what can you do to tell this fetus is a premature? Okay, so what we have is that we need to look at the head. When you look at the head is what will happen is that the head will be large in proportion. Okay, it will be large. So if you look at the head will be large, and then you say, oh, this one is a premature. But you need to check, is it hydrocephalus or just prematurity? But the head will be bigger. Okay, so it will be larger in proportion than the body. So the body will be smaller, then the head will be bigger. So you need to really assess properly. Okay, so look at a big head, small body, that's a premature baby. Okay, then what about when you look at the sutures and the fontanelles? So for those who are looking at maybe, so what are the sutures, what are the fontanelles? So you look at those if you're dealing with pediatrics and maybe the fetal head, you look at the sutures and the fontanelles there, anterior fontanelle and the posterior fontanelle. Those will be widely separated, meaning they'll open up, so they'll be widely separated. And then the skull bones will be soft. So when you palpate the skull bones will be soft, but the sutures will be widely separated, so that you'll be able to tell. Okay, then what about the skin? So you need to know what you're looking at. If you look at the skin of this premature baby, it will appear brick red. I'm sure those who go through papers, you find this, they'll try to ask you to differentiate the color of the skin. So it will appear what? Brick red. So brick red, why? Because there is that absence of subcutaneous fat. That's why it appears brick red. Then another point under the skin will be, this skin will be covered in what we call lanugo. It will be covered in lanugo. Then lanugo, what is lanugo? Lanugo, this is hair, soft hair on the skin of the baby. So you'd find that you find this in one-way dancer or cross-match. So lanugo is a fine hair or hair on the skin of the baby. That's lanugo. So you find it on a premature baby. Then another thing that you need to know is that on the skin there will be little venix caseosa. So little venix caseosa, they'll ask you what this is, meaning that this premature baby has little, what that greasy substance, the whitish thing on the baby, it will be very little. So that's what we call little venix caseosa, because it's supposed to be there coating or protecting the baby's skin, but in prematurity to be very little. So meaning that this is not well protected. So that's what you know. This is a premature baby. Okay, a very little venix caseosa. Okay, then what about the upper limbs and the lower limbs? Okay, they are thin and the nails are soft. So to have thin limbs, nails will be soft. What about the creases? You know, when you talk about the creases, when you look at these lines here, these are palmar creases. Okay, plantar creases are for the feet. Now palmar creases are these lines here. So you find that these lines will not be well formed. So the palmar creases and the plantar creases, these lines here, they will not be well formed. Okay. What about the chest? The chest of a premature baby will be small and narrow. That's what you're going to check. It will be small and narrow, less than 33 centimeters. We know that the chest circumference is between 33 to 35 centimeters, so it will be smaller than 33 centimeters. Okay. What about the abdomen? The abdomen is often what? Large. The abdomen is often large and distended. Okay. And the umbilicus will appear low set, meaning the umbilicus appears low set and it's mostly, you know, large and distended. That's what you see as a feature, a characteristic. Let's look at the genitalia. What happens with the genitalia? The genitalia, it is small and, okay, so let's say in females. In females, it is small. The genitalia is what? Small. What about the labia? Okay, so the labia majora, does not cover the labia minora. Okay, so the labia minora will be bigger or larger than the labia majora. That's what happens. So in simple terms, the labia minora is larger than the labia majora in prematurity. Okay, what about in males? In males, mostly you'd find that the testes are not descended, are not there in the scrotum. They're not descended into the scrotum. That's what you find mostly in males. Okay, then in males again, you'd find that the scrotum will not have the rugae. You know rugae? Rugae is those bumpy or grooves. Is it like the bumpy on the scrotum? Okay, more like the folds on the scrotum. So those will be few in males. What about the muscle tone? In terms of the muscle tone, these children will have very poor muscle tone. Okay, very poor muscle tone. What about the sucking reflex? So the premature babies will have poor sucking reflex, which may be present but poor, or completely absent, meaning they will not suck. That's what happens. Okay, then let's look at, sometimes you may find a question in completion which is asking you about maybe how you can estimate maybe how you can measure the neurological and physiological or physical maturity. So there is what we call a Ballard scale. So for these, you're going to use maybe a Ballard scale. What we call Ballard scale, meaning you're going to measure the neurological and physical maturity. So it's a scale which you use to measure the neurological and the physical maturity of the baby, and it's carried out within 72 hours of delivery. So you find this in one-word answer, or even just MCQ asking about the Ballard score, how you can use it. So this is the scale that we use to score. It's called Ballard score. Okay. Then what about in terms of nursing? When you're nursing these, so I said it's either you assess, is it an emergency you're dealing with or just ordinary? So for you to know this is an emergency, to add other things, such as maybe this premature baby is not breathing well, he's having dyspnea or cyanosis, or it has gone into hypoglycemia, so you need to know, you need to resuscitate if you find that. So I said earlier that we need to look at how you write this care. So we're going to write the nursing care. I'm going to present where we write the nursing care in terms of when you're dealing with resuscitation, where you write the ABC, and then do the we are going to do the ABC, which is resuscitation, do the investigations, okay, and also deal with the drugs. Then do the nursing care, which is prophenema, which is subsequent care. So when you're dealing with an emergency, like I earlier emphasized, you start with resuscitation, where you put the ABC, okay, then you do the drugs, the investigations, which will follow later, then you do the subsequent. That's what I earlier on said. So that one will come, and then the nursing care plan, we need to identify some problems here. So we need to be very careful here. We need also to look at the problem. What are some of the problems that this premature baby might face? Okay, so that's what we need to check as well. Okay, so if you try to check, you're going to look at issues to do with nutrition. Okay, so you will find that the problem that this child will have issues to do with nutrition. Okay, so under the nursing care plan, we need to check out that. Okay, it will have a nutritional deficit. Okay, that's what it will have. So you need to identify such a problem in a nice way. Okay, nutritional deficit less than body requirements. Okay, your nutritional status less than body requirements. So I'm going to come up with that so that you're able to write. Okay, nutritional status less than body requirements. So I'm going to check. Then what about the fluids? Okay, it will have maybe say a fluid volume deficit. So you need to write that as well. It will have a fluid volume deficit. Okay, then what are some of the problems that it will have? It will have hypothermia. So it will have this child will be at risk of hypothermia. So risk of hypothermia, you can put it there. Then this child is a premature, it will have a risk of infection. So it may be at risk of infection because it is a premature, it's not able to have that good defense to infection. So need to really identify the problems that you're going to put across here. Okay, then the nursing care, you need to, like I emphasized, resuscitation. Then if there is anything to do with emergency, then subsequent care. Then if you look at now the other part, what is maybe what are the problems that this child might have in terms of complications? Okay, what is it? So the child will have respiratory distress syndrome. Okay, meaning that they will be failing to breathe. Why? Because of surfactant. They'll be lacking surfactant. So that's why they might go into respiratory distress syndrome. Another complication might be hypothermia. We know that this child is not having enough brown fat and enough subcutaneous fat, so it will go into hypothermia. What about another complication? It will be infection. Infection because this child has not received, okay, IgG. Okay, this child has not received IgG, which is passed from the baby in the last trimester. From the mother to the baby, IgG is passed. So it will not receive the IgG, so it will be prone to infections. Okay, another problem or complication might be hypoglycemia. We know that the liver is not fully formed, so even the glycogen storage is poor. So that's why it may go into hypoglycemia. Another complication might be anemia. We know that the iron stores are not fully developed, so it will be going into anemia. Okay, then lastly, this child will be having cerebral hemorrhages. Why will it be having cerebral hemorrhages? Because this child is deficient of vitamin K. Because it's premature baby, so it will be deficient of vitamin K, so it will be having cerebral hemorrhages. So we'll keep on discussing these conditions, and if you like the video, kindly subscribe or like the video or share the video. Thank you very much for watching, and we'll keep discussing so that at least we get to write that exam in a good way. Thank you very much.